And we're back. I'm your host, BKP. We are at Blue Jeans Pizza in Blue Ridge, Georgia. Beautiful, cool mountain morning. Come up and visit us this weekend. You'll really enjoy it. But I'm really excited about this next segment because, no, this is not Dr. Whaley. And no, this is not Ray Tidman. But this is Dr. Jennifer Jones. Glad to have her with us. Thank you, Georgia Cancer Specialist. Ask the doc. Dr. Jones, how are you this morning?
I'm doing great.
Okay, so, you know, I don't put people on the spot, but I have asked questions on the spot, so I'm going to do that. Ready?
Okay.
You were here last week, so you could see, you were sitting in the audience, how things work. Okay.
Yes.
And you were here early enough this morning to see how things work.
Yes.
So, do I say anything that really catches you off guard? That's putting you on the spot.
Not really, not really. I think my line of thinking is very much in line with your line of thinking. So, no, I tend to agree with most everything that you just said.
Did you write that down, Sam? You didn't write that down? Just double checking. Huh? There's two things they say at the office. Don't poke the bear and don't feed the ego. So, anyhow, just joking. Anyhow, thank you, Dr. Jones, for being here. I always like to, and I think you know this with Dr. Whaley and Dr. Tidman, is open up and give you an opportunity if anything out there or anything we talked about this morning is of interest to you that you would like to comment on or be a part of in the show.
Absolutely. The first thing I want to do is give you a corny joke, if that's okay, because Dr. Whaley said I have to do a corny joke because it's just, you know.
Okay, it's part of the show, folks.
It's part of the show. So my corny joke, since it's kind of almost Halloween and I kind of dressed that part, the corny joke is, who is the best dancer at the Monsters Ball?
Sam, can you help? Rose? Larry?
Any guesses?
We're 0 for 4.
It's the Boogeyman. See,
you know, there's a feeling that somebody's going to break into singing the Monster Mash.
Right.
Okay, Corny. Very good. Very
all right,
okay.
Good.
All right. So there's your show opener.
So there's my opener, right. I wanted to talk to you a little bit about the opioid crisis in America right now. I think that's a very hot topic right now in the world of medicine. I really personally believe that it is a personal responsibility of the physician who is prescribing that drug to make sure that they're prescribing it appropriately and to the right patient. I think it's an epidemic in America. We've had our own local crisis here in Blairsville with unscrupulous prescribing within the last couple of years. The state of Georgia has actually enacted a Georgia narcotics drug or prescription drug monitoring program that will start January 1 for all prescribers of opiates in the state of Georgia. And it entails several things that prescribers are required to do. And one of those things is they have to register, if you have a DEA, a drug DEA number in the state of Georgia, which enables you to prescribe narcotics, you have to register with the Georgia Narcotics Registry. You have to go on that list and look to see if your patient has received any opioids from any other prescriber in the state of Georgia. And if they have, then that goes into the Georgia Narcotics database. So if they have and you identify that, you have to address that with the patient because you're not supposed to prescribe unless you have good intent or good reason to prescribe narcotics to a patient who've already been prescribed narcotics by another provider in the state within the same month. So that'll give us information about who is getting drugs from whom. And also, you're supposed to counsel that patient about it. Anytime you give a narcotic, you're supposed to counsel the patient about the narcotics, the dangers of the narcotics, and you know, other things. They're not to share their prescription. They're supposed to keep it out of the hands of children. So it's putting the onus back on physicians to be responsible with their prescribing measures. And that's going to start January 1, 2018. Also, patients are going to be tested for opioid and other abuse. So if there are any other prescription drugs or any other non-prescription drugs in their system, you're not allowed or you're not supposed to prescribe an opioid to them. So that helps us. It's hard for prescribers just from our side of things to know, you know, you think everybody's honest, and I'm one of those people who try to trust people until I have a reason not to trust them. But there are a lot of unscrupulous people out there who want to get drugs and put them on the street and make money off of them. So we have to kind of be a little more responsible with what we're doing in order to prevent that from happening. And that's part of that. So all prescribers have to do that in the state of Georgia, January 1, 2018. Some exceptions to that are patients who are terminal illness patients, patients with terminal cancer. So some of those will be exempt from that, but other patients who are getting them for other reasons, the prescriber has to do that.
Well, maybe this is large in part for I like everything I'm hearing, and I think this is large in part because let me run this by you while we're talking about that, if you don't mind. Georgia has obviously done some things on the positive side, because I'm going to go back to 2009. Okay, we're 2017. I'm going to go back to 2009. And it was not uncommon to have an enormous amount of billboards that said pain management clinics. It was not uncommon even in North Georgia. I mean, I know in North Georgia areas where on Fridays and Saturdays they would be signs in the ground on every corner of every intersection, pain management clinics. But that seems to have dwindled and have dried up somewhat, and the pain management clinic on every corner seems to have slowed down. Is this part of that, or are there other things that have taken place in Georgia that help, stop that? I didn't mean to ask that.
I think this is part of that. It's a real effort by the state of Georgia to kind of crack down on narcotics use and abuse. And it's a tricky situation. They do work well, but they do have abuse potential. Those medications in particular. I mean, in my field, obviously, patients have terminal cancer, so
right, exactly.
we need those drugs. People need the comfort.
There needs to be pain management.
Absolutely.
I understand that, and I'm not by no means saying there shouldn't be pain management, but when I'll see a billboard that has a picture and it says family physician, and I agree with that, fine, and I know physicians do advertise themselves, but I've yet to find the family physician that had to buy 300 yard signs and put them on every corner of the intersection.
Right.
All right, maybe we should move on.
Well, yeah, sure. I think part of what President Trump signed into action last night was to help curtail that and to help people who have that problem find help. So those pain management clinics, I don't know if they're really helping people or if they're just perpetuating a problem. So again, I think part of that legislation, when he was talking about that last night, is going to help that and help that problem.
And you support what he did?
I do. Okay. Yes, I do. I
right.
think it's a very bad problem, and particularly here in this area, we have a very bad problem with that. And also heroin. That's
yes.
another one. It's an epidemic, even in this small community here. It's terrible.
Well, I'm going to stay away from it, but in the dead of July, when I'm seeing people walking around in hoodies and long sleeves,
yeah,
I don't want to say I know, but that's not fair to people.
Sure.
Somebody may want to wear a long sleeve no matter what, but at the same time. So, and I know it's going to take some time to, what they say, unpack what the president did and see what all's involved. But on face value, he said it was a crisis when he was running, and he said he was going to do something about it. Yesterday, he came out and from a presidential executive order.
He's making an effort, and I think that's important. It's a good precedent for our country.
Okay, we got to go into the questions. Let's
do it.
I think I could keep talking other direction. Okay, this morning, this is one I'm so glad we have this question, because I don't know when warm and cool is best. So the question is, when should I use a cool mist humidifier versus a warm mist humidifier for relief with a cold?
Okay, so that's a good question too. And I actually didn't know the answer to this one, so I had to go look it up. And the answer is there's really no difference, because what a humidifier does is basically put moisture into the air to make it less dry and make it less irritating to the lungs. So if you already have some irritation in your bronchial tubes because you have a cold, or in your sinuses because they're dry and you've been blowing your nose a lot, then the humidification in a humidifier basically puts moisture into the air to kind of alleviate that. A cold mist humidifier does that with cold water, and a warm mist humidifier does that with warm water. So by the time the air actually gets into your alveoli, the distal part of your lungs, the air is all the same temperature anyway, so it doesn't really matter in that regard. If you have a warm mist humidifier, the water is boiling, so it's very hot, so you don't want to use that around a child, particularly if it's your child that has a cold, because they could spill that or burn themselves on it. And also the warm mist humidifiers do decrease the amount of bacteria that's perpetuated into the air. So a cold mist humidifier, any kind of standing water can grow bacteria in it, and then that can be dispersed into the air. So you want to make sure you clean those every night and dry them out so that you're not leaving any standing water for bacteria to potentially grow in.
Okay.
So no major difference.
Several months ago, I developed a small white patch on my skin, on the skin of my arm. It appears to be getting larger. Is a white patch on skin anything to be concerned about?
Okay, so that's a really good question, and I had a couple of pictures that hopefully will get shown up there. So different things can cause white patches on the skin, and one of the things that we see, you're very fair-skinned like I am, is that fair-skinned people, particularly men who have been in the sun a lot in their younger years, can develop something called actinic keratoses. And what those are these white patches that develop on the skin. They usually have kind of a reddish base and then a white patch that's kind of scaly on top of that. They can range in size from millimeters to a couple of centimeters, and those are basically sunspots. The significance of those is that they can progress to what we call a squamous cell skin cancer at a rate of about 3 to 20% per year. So as a pre-cancer, it is probably something that needs to be checked on with a physician. A squamous cell skin cancer, as you can see from the pictures, they look very similar to an actinic keratoses. They also look like a scaly white patch on your arm, and if they're growing particularly at a rapid rate or causing symptoms, or you feel like a fullness in the skin beneath them, that's a signal that it may be something more dangerous, such as a skin cancer, a squamous cell skin cancer, and needs to be addressed by a physician pretty quickly. Very rarely, most of the time, those just spread locally under the skin, but very rarely, I've had a couple of cases where they actually get invasive and spread throughout the body. So that needs to be addressed pretty quickly.
Okay, did we have pictures or? Okay. Now I know you think, no, wait a minute. So while you're answering this question, I want you to have something else you're thinking about.
Okay.
Okay. I know you think this is the last question, but it's not.
Uh-oh.
I have one.
Okay. A surprise question.
It'll be okay, I promise.
Okay.
What's the difference between a tumor and a cyst? Could a cyst be cancerous?
I think this is a great question, and a lot of people are curious about this because a cyst and a tumor kind of look the same. It's kind of a bulge under the skin or something inside of an internal organ. You go to the doctor and they say, oh, you have a cyst in your kidney or you have a cyst in your liver, and immediately you go, oh my gosh, there's a spot on my kidney, there's a spot on my liver, and you get very nervous about it. But cysts and tumors are very different things. So a cyst is basically a pocket, an isolated pocket that has some kind of material inside of it. It can be fluid filled, it can be fatty filled, it can be filled with proteinaceous material, but typically those things are benign. But a tumor is actually a solid group of cells clumped together in a mass. And tumors can also be benign. So there's a distinct difference between them, but tumors can also be malignant. And then sometimes you can actually have what we call a cyst adenocarcinoma, which is a cancer that actually has cyst-like material attached to it. So the bottom line on that is they're very different things. One feels, I always say my fancy medical term is squishy. So a squishy, that's more like a cyst. You can poke it and it feels squishy, like a rubber ball. But a tumor actually feels very solid to the touch if it's something that you can palpate. If you're looking at some kind of an imaging study or your doctor tells you you have a cyst in the kidney or you have a cyst in the liver, most of the time those are nothing to worry about. And they typically use the term simple cyst, meaning that they're just a cyst and there's nothing else attached to them. If it's a complex cyst that has what we call septations or has more of a solid component around the rim, those are more likely to be malignant or if they're growing rapidly and need to be addressed.
Okay, thank you very much. That was a very serious question. All the questions were very serious. We appreciate those answers, and we know out there that you look forward to this segment every week. But this question came in earlier this morning, and I thought it was something we can add now. The question is, I feel really stressed out. I've got anxiety, and I don't know what to do about why the Yankees fired Joe Girardi.
that's probably situational anxiety, and hopefully it'll pass soon. But I'm sorry.
Oh, I thought there was no better place to ask than the doc. I mean, see, I told you, right?
That's all right. That's all right.
Yeah. Well, stressed out. I've got anxiety. I don't know where Joe's going. I don't know who's going to be the next manager. How am I going to get through the day?
We could do some counseling later.
Okay. I think I have a Braves fan here, maybe.
Oh, yeah. Okay.
Okay.
Oh, you mean me?
Yeah.
I like the Braves. I'm a Braves fan. I'm a Steelers fan. And also I used to live
Should I ask how that happened?
I dated a guy in high school. Remember when the Braves and
Tell
Steelers...
me more. This Ask the Doc thing is over.
The Braves and Steelers, you know, they were in World Series together way back.
Oh, you mean the Pirates?
The Pirates, not
Yes,
Steelers.
the Pirates. That's
Pirates.
okay. That's
Sorry.
okay.
Yes, and actually
You
the
dated a
Astros.
guy in high school.
He was a big Pittsburgh fan,
Yeah.
so I ended up kind of following them as well.
Oh, yeah.
But no, I mean, you got to give the Astros some credit, you know, because
No, you give the Astros no credit.
a little bit.
Oh my gosh! I'm glad there's a
What about
doctor
others?
in the house.
Well, you know, God bless Texas, right? I mean,
Oh, I know this is getting worse.
they had
How can you
Harvey.
do that?
They had
I mean, the
Harvey.
guy just sent in
They're
that he's stressed
suffering.
out, and you're like, and the only thing you can say is, oh, you got to give the Astros some
A
credit.
little bit. They worked
Oh,
hard.
my
And the
gosh.
people of Texas, you know, they're healing from Harvey.
Okay,
They
this
need a little
has to be.
boost.
This needs to be over.
Sorry.
No, that's okay. Oh, okay. Moving right along.
You said
I
prepare.
opened it up.
That's right. That's right. Well, we can talk about it.
Let's do this though. What we like to do before we close our Ask the Doc segment, is there anything in the medical industry, in the medical field out there that you've been looking at or reading recently you'd like to share with the viewers?
Actually, I was thinking more about politics in that line, in that regard.
Go right ahead.
Only
Oh, go
because
right ahead. Let me cut the carpet and roll it right out for you. Go right ahead.
that seems to be your forte. And as we were talking about right before the show, I'm very disturbed by the media and the whole Google enterprise and the way that Google has kind of capitalized on YouTube, and they're censoring particularly conservative people who are trying to express their views on YouTube. So that's one of the things that's really been bothering me lately. I think people have a difficult time finding accurate information online, and also accurate information in every news media outlet. So if you flip on your TV, the majority of what you're going to read or hear is going to be kind of skewed to the left, and this sort of alt-left agenda that seems to be perpetuated in the mainstream media in general.
She booked her for the All-Star panel. Maybe you'd like to, huh? Yeah, we might have to. No, I mean, you know, earlier I was talking about that, and my thing is, in most ways, are people able to, in this information age, discern between the noise versus the news?
I don't think so. I really don't think so. And I interact with a lot of people, and we're largely in a pocketed conservative community, but I find that a lot of people, they're uninformed. They are just uninformed. They don't really see a lot of times what's really happening, because they tune into the mainstream media, or they read, you know, I don't know, one of the popular newspapers, even the Atlanta Journal and Constitution, a lot of times is kind of skewed left. So, and that's one of our major news sources in the area. So I agree with you. I think people aren't able to discern because they don't get the other side, the other viewpoints, or the more truthful reporting.
Well, what I do say now, I joke around on my show Monday through Thursday, and I have a good time, and I poke a lot of fun. But what I do say is, I encourage people to do their own research. You know, I do 2 hours a day Monday through Thursday, and I encourage people to do their own research, look things up for themselves, validate what they're reading, and then when the mainstream media, or whatever we may call them, report something and they hear all this noise, look at what might be laying underneath the noise that they're not being told. I always believe the noise is a cloud cover for the reality that's out there.
I agree.
Do you?
I completely agree.
Sam, have you written any of this down? I'll tell you what, you are welcome to come back with, you're very agreeable, and I thank you. Did you enjoy yourself today?
I did very much. Thank you so much for having me.
Okay, well, Dr. Whaley, we need to talk. Oh no, Dr. Whaley. So we always want to thank Dr. Whaley, Bill Whaley, and Dr. Raymond Tidman that do come on the show, and we're so glad to have this morning Dr. Jennifer Jones with us, and we thank the Georgia Cancer Specialist for this segment. And if you have a question for Ask the Doc, please send that to info, info at FetcherNews.com, your question for Ask the Doc, and we will get that put in the title, Ask the Doc, so we know. Okay, put in the subject, Ask the Doc, and we will get that to the doctor throughout the week, and maybe get your question on our next segment. Again, Dr. Jones, thank you very much. We will be back right after these messages, and we're going to talk a little bit about Light Up Blue Ridge. If you've never been up here during the holiday season, we're going to talk about it right after these messages. Again, thank you very much.
Thank you so much.